In a surprising shift aimed at reducing its growing debt, the National Health Insurance Authority has announced that reimbursements to hospitals will now be done per patient after verifying treatment through individual receipts. The NHIA says this approach will prevent the accumulation of unpaid claims, a long-standing issue that has left its owing facilities across the country.
There have been some complaints from providers about late reimbursements, and then some have also complained about the tariffs being too low. So there's a ongoing tariff review, which I talked about. Hopefully the new tariffs will be out shortly. And then with the uncapping, we are looking at a situation where providers submit their claims, and once the claims are vetted or adjudicated, they get paid. So that in that case, the reimbursements will not be delayed, and then there won't be that excuse of NHIA has not paid us, NHIA has not reimbursed us, in which case providers are asking members to pay.
At a high-level meeting in Accra, the Ghana NCD Alliance rallied stakeholders ahead of the UN's 4th global meeting on non-communicable diseases and mental health. Labram Musa is national coordinator of the Ghana NCD Alliance.
And one of the key things that we have finally looked at is the fact that we have to, avoid or do away with the siloed way of working. The second one is about investment, in fact, adequate investment in the area. And then also we are looking at the accountability. How do we ensure that we hold government into account?
The burden of NCDs continue to weigh heavily on Ghana's health system, consuming household incomes and costing lives. Dr. Ignatius Awimbuno, Chief Program Officer at the Ministry of Health, outlined initiatives that are already in motion to ensure free primary healthcare services for NCDs and mental health at a community level to make care more accessible.
Also have the primary healthcare policy that has been brought in by the government that seeks to ensure that all services from the polyclinic, health centers, and other centers below the polyclinics receive health care for free.
Despite government reassurances, healthcare providers say unless outstanding debts are cleared and timely payments guaranteed, trust in the insurance scheme will continue to erode. As Ghana gears up for the Global NCD Summit, stakeholders say the country must first fix its own system, starting with restoring confidence in the very scheme designed to protect the sick and the poor. Jennifer August reports for Joy News.